express appreciation to our nurses for showing interest in the care of COVID-19 patients, because you know it's a new disease. We never prepare for it. We were actually trying to celebrate year 2020 as the year of the nurse and midwife, and this came up. But like I said in one of my presentations somewhere, I said we are celebrating Florence Nightingale today because of our efforts during the Crimean War, how she catered for soldiers and the rest. So this COVID-19 is another war which nurses must be prepared to win, so that our effort can further be appreciated. So I want to thank all our nurses for the wonderful job they have been doing. Our impact in the care of COVID-19 patients cannot be overemphasized. We are at the forefront of the struggle, and we come in contact with them either at the isolation centers and even in our all other hospitals, because we come across them in our OPD, in our casualty, in our emergency department, even before referring them to the isolation centers. So all nurses, irrespective of where you are working, you are highly appreciated, because we are all involved in this pandemic. So nurses have been trying their possible best in triaging, in early detection, in referring to the clinical, to the isolation centers. We are also actively involved in the clinical care of the patient. So medication, other physical care, nurses are there, coming in contact face-to-face with the patient. So we are all appreciated. We are also involved in advocacy. Advocacy for the patients, advocacy for the nurses. And I want to appreciate all our leaders, especially the NANNM Chairman in Lagos State, Comrade Israel Blessing. She has been doing a lot in this particular aspect. We have seen her on radio, on television, channel television, and the rest. She has been going there to talk to the public on what they should do to prevent and protect themselves, and what is expected of the public, of the government, to healthcare workers. So advocacy is part of what we are doing as nurses. And you know, when one person is infected, it has ripple effects. Many other people are also prone to the infection. Other co-workers in the hospital, the husband, the wife, the children at home, even in the public vehicle. So we are also being involved in contact tracing. You are not interested on that one particular person that is infected, but you want to know how many people are also likely to have come in contact with that particular person. So contact tracing is another thing that nurses have been fully involved with, and which we continue to do. And we all know that it's becoming a community infection now. So we continue to do contact tracing because we must reduce the spread as much as possible. So this is part of what we are doing. And in the hospitals, in the isolation centers, we are managing symptomatically, because you know, like all other viral infections, there is no particular drug that we can say specifically for this condition. So we manage symptomatically, and as of today, there is no vaccine that has been really confirmed to be effective against COVID-19. So we continue to manage like that. We manage, monitor the disease progression. You want to know, is the temperature coming down? How is the cough? How is the respiratory rate and all that? To really show that the patient is improving. So all these things we are doing on a daily basis, we while also trying to protect ourselves, because we know that we must protect ourselves not to get infected. We are also aware that for someone to come out of it successfully, we must boost the immunity of that particular person. So we encourage our clients to eat nutritious food and take multivitamins. So whatever they can do to actually improve their immunity is also very, very important at this particular point in time. And we also need to do assessment whether they have any underlying disease condition apart from the COVID infection. Are you hypertensive? Are you diabetic? Are you asthmatic? And the rest. Because it has been confirmed that any underlying disease condition can make the prognosis to be poor. So we want to know all these things so that everything can be managed together for the person to come out successfully out of the infection. So these are some of the things that we are doing. And you know, as nurses, we do a lot of job. We even coordinate the activities of other health workers. You want doctors to come and see the patient, it's you that will make sure that that is done on time. You want the nutritionist to come around. You want psychologists and all that. Whoever you want to really come and attend to the patient, you have to coordinate the activities of other health workers. And that is why we are at the forefront. That is why the fulcrum upon which all other services depend on. So we coordinate the activities of health workers in the hospital. So basically, these are the things that we are doing at present.
Okay, thank you very much for that beautiful answer. You highlighted a lot of functions and the roles that the nurses are partaking, especially during this COVID-19 pandemic. And then we can see that nurses are doing a very wonderful job. And then they have a very specific role.
Supporting the Nigerian nurses.
Yeah, the next question is what are the roles of what is NANM doing in supporting the nurses during this COVID-19 pandemic?
Yes, I've seen the question. You are asking about the roles of NANM.
Yes, because we know that there are so many issues that are surrounding NANM, Nigerian nurses. And then what are we doing?
As we all know, the National Association of Nigerian Nurses and Midwives is a labor union as well as a professional association. So NANM is actually playing a dual role. And the International Council of Nurses has really said that health system and strong association goes hand in hand. So health system cannot do without professional association. So NANM is actually playing a good role. And once again, I want to commend the Lagos State NANM for the role that they have been playing. They have been visible since the beginning of this pandemic. They have been to various isolation centers to look at the welfare of nurses in those facilities. They have distributed some items to nurses at the isolation centers and in other general hospitals. They have been doing this on a regular basis, and we really appreciate this. NANM also has been part of decision-making. Policy on health should not be done without the involvement of professional association. In Lagos State, we have emergency committee set up by the state government on COVID-19. And I'm aware that the association has been actively involved in this committee. So all policy relating to COVID-19, NANM is expected to participate in it. so that whatever is coming out will be beneficial to the patient and also beneficial to the workers. So NANM is actually actively involved in this regard. Then advocacy, like I said the other time, NANM has been actively involved in that. We have seen them on social media, on Twitter, on Facebook, on media, radio, print media, television. They have been actively involved in this particular aspect. So these are part of what NANM has been doing. And as a professional association, like I said, NANM is a labor union and a professional association. NANM is also expected to issue out guidelines to members. And they have been doing this. Like there was a time they released a message that if you don't have adequate PPE, please protect yourself. You should not, there's a saying that in pandemic, there's no emergency. So which means you must be well protected before you can care for patients during pandemic. So they have been issuing out statements so that nurses can actually guide against being infected. So they have been doing this, and we want them to continue to do that, because we are not happy that we lost one of our members at Lagos State University Teaching Hospital, and the information getting to us shows that there was no adequate protection. That was why she was infected. So we are not happy about this, and we don't want another victim. We want everybody to be well protected, and I strongly believe NANM is on top of this. NANM is also at the forefront of fighting for incentives for healthcare workers. Although we are yet to see the alert, at the federal level, it was confirmed that they are going to pay certain allowances for people that are really involved in this pandemic. So we are still expecting that. We hope the federal government will fulfill that, and we hope that the state government will also emulate what the federal government is doing. Because like I said, it's not only the nurses working at the isolation center that, in fact, the people that have been infected so far and people that have died so far, they are not really at the isolation centers. They are those working and they come in contact patient without knowing their status. So everybody should be taken care of, and I strongly believe that NANM is on top of this. So NANM is actually doing a lot to ensure that we are up and doing, and that we are well and well protected.
Thank you very much for that beautiful answer as well. Another pertinent question that is being asked is that isn't this a period where the nurses should be recognized in Nigeria by giving them their adequate status? And then why not use this opportunity to get things done in the right way? Because I know sometimes ago there were news flying around on the social media that doctors are using this opportunity to get what is rightfully for them, while the nurses were folding their arms. For instance, in issue of allowances, there were a lot of disparities between the allowances of a medical doctor as well as the nurses, while both of them are doing a very wonderful job while taking care of the patient. Isn't this a very crucial period for Nigerian nurses, most especially the labor union, the NANM, to put things right straight away?
Recollect that asset allowance before now has been a flat rate for all workers, all healthcare workers. We have all been on the same hazard allowance of 5,000 naira per month. And we raise alarm. Even on my own part, I also raise alarm that are we going to expose ourselves based on 5,000 naira? And we were so happy when the speakers of representative also talk in our support that we deserve to have more of allowance in this respect. I discovered that in negotiation, many things used to happen. And how we arrive at 50% of basic salary, consolidated basic salary, and without looking at the disparity that it is going to cause is the problem. I think, well, I wasn't part of the negotiation. I wasn't at the national level. Our organs at the top, they are already looking into the matter, because I saw another release from Joesu stating that they will not go for 50% of consolidated basic salary for everybody. I would have loved a situation whereby people that are at the forefront are given the higher amounts than others. Nurses are at the forefront. We are the most exposed healthcare worker. And based on that, we should even have the highest allocation of this hazard allowance and even other allowances. So we have to go to our drawing board. We have to sharpen our negotiation strategy so that we can get more for nurses. Nurses actually deserve to have more. And it's never too late. We must appreciate what our leaders, what they have been able to do in the past and what they are doing now. And we should not, I'm not always comfortable condemning them. Instead, we should appreciate the little they have been able to do, and we should encourage them to do more. Many a times, our colleagues will go on social media to condemn, to blame, to cause, and all sorts of things. That is not the way forward. Let us encourage them. Let us give them suggestions on how to move the association forward. And I strongly believe that we will get there. So there are needs, and I want to hope that they will get what we want for us.
Thank you very much. I hope the Nigerian nurses will get their dividends as they are carrying out their work diligently and professionally. I have two questions before we end this conversation. The first is that ever since you've been out of office as the ex-NANNM chairman, how has it been going with you, sir? Then what advice do you have for the incumbent so that they can as well do a very better job that with the foundation you have laid so far? So we can't hear you, sir. Okay.
Yeah, thank you very much. We have not really detached ourselves from the incumbent chairman and the other executives. We are still working together. We are still talking, and we really want them to perform more than what we did while in office. So we are still working together, and we are giving advice when necessary. Presently, I'm a clinical nurse. I've been a clinical nurse from onset, and I'm back fully on duty taking care of my patients. So I'm happy doing this, and that does not take me away from NANNM. I'm still part of NANNM. The progress of NANNM is still my priority, and we are doing everything possible to move nursing forward.
Thank you very much. And the last question is that as someone that has been in the corridor of negotiation in terms of trying to do some administrative work for the welfare, for the nurses and some other things, what do you think, what has been the very greatest challenge has the NANNM chairman at state level, and what suggestion do you have for the states and federal government in order to enhance the productivity of Nigerian nurses?
Sorry, please, can you repeat the question, sir?
Being an ex-chairman of Lagos State NANNM, you've been able to go through a lot of challenges, and which usually is based on the welfare of the nurses, trying to champion the causes for having a very good allowances, a very workable environment, and some other things that are involved. What has been the greatest challenge so far, and what suggestions do you have for the government, both at the state and federal level, so that this can enhance the productivity of Nigerian nurses as a kind of stimulant?
All right, thank you. Although I couldn't hear very well, but I will try and respond to the one I was able to pick. First of all, I want to appreciate all my past executive members that work with me. A tree cannot make a forest, so they really helped me to achieve the little we were able to achieve while in office. So kudos to all the past State Administrative Council of NANNM, 2016 to 2019. I was actually blessed with a team, the best team, I would say the best team so far in NANNM Lagos. I was blessed with them. So as a team, we were able to achieve a lot. And something that really helped me again is that I set before myself a vision and a mission statement. Like my vision statement said that to make NANNM Lagos a vibrant association that is well respected in the society. I also have the mission statement, provision of transformation leadership, all-inclusive administration, and injection of new innovative ideas. So having this before me actually helped me to know where I'm going, what I want to achieve. So I want to implore my new state chairman to set something before herself so that will be guiding her on what she would like to achieve while in office. I also have my manifestos. I listed all the things that I would like to achieve while in office. And to the glory of God, I was able to achieve majority of them. I think one or two was still outstanding, but the manifesto actually helped me to put before myself what I would like to achieve. If you don't have a plan, there's no thing you can achieve. So you must be able to plan something for yourself, what you want to achieve while in office. So that really helped me, and we achieved a lot. Time may not permit me to start listing some of these achievements, but that really helped us to achieve a lot. So, suggestion to the government. This COVID-19